DCA are a virtual healthcare service. We're offering patients 24 hours a day, 7 days a week access to appointments with a virtual GP. We offer same-day appointments. Right now we're doing 60,000 consultations a month. We offer end-to-end digital healthcare service across primary and secondary care. We have partnerships through multiple organisations to deliver these services.
At Doctor Care Anywhere, we're really proud to offer the digital patient experience, and the feedback from patients is fantastic as well. So we've got the quality and the quantity of appointments available for our patients. And I think the heart of that good feedback is our GPs, but it's also the excellent service that our patient coordinators deliver, and the training team are always there to support them to offer that excellent service.
At DCA, you are part of a team. You have your own dedicated team leader and your own team. Within that team, you have regular one-to-ones, you have regular team meetings, and you get the opportunity to have huddles with your team once a week as well.
So yes, it's a busy role, we have lots of consults happening. They're also very mindful that the quality needs to be there and putting the patients at the heart of everything they do.
So as a patient experience coordinator, you will be the first point of contact for a lot of our patients. You'll be supporting them with queries via telephone or via email. You'll be dealing with prescriptions, verification checks for our patients.
It's very diverse, very fast paced. There's plenty of patients that will always need our help, whether that be with getting a same day appointment or just needing help updating their profile photo on their account. So there are 6 different shift patterns that I work. So it will start ranging from 7 o'clock start in the morning all the way through to a 12:30 in the afternoon, whereas at DCA we can offer 24-hour availability, so the patients always know that we are there for them. And it's a very rewarding experience when you sign off with a patient and you know that you've made an improvement for, if it's not their life, it's just the day, you've just made a part of their day a little bit easier, and that's always a good feeling.
I am genuinely passionate about being a patient experience coordinator at DCA, being able to help people on a day-to-day basis, whether it be creating an account, verifying an account, tech issues, booking appointments, chasing appointments, even going from GP to patient. It suits my personality so much. I've done some brilliant jobs in my life, all helping people in some way or another, and never really felt complete. This job, I have that. I see the difference that we make. I see how passionate other colleagues are at putting the patient first.
My role as PX coordinator, it's a very varied role. It is patient facing. We do various different tasks throughout our day. So for me, for example, I could be talking to patients on the phone. I'll be helping them set up their accounts, helping them issue prescriptions or book appointments for them. I could be talking to patients on the phone. I could be answering emails. I could be sorting prescriptions. I could be working on referrals or chasing up results for patients. So everything is laid out a bit differently. So it's never just you're doing one thing all day. We'll have different tasks and bits that we'll do throughout the day. So it keeps everything fresh.
For me, day to day, it's all about supporting our coordinators within patient experience, making sure that I'm available when they need them, when they have any queries. Also supporting our GPs on the platform to make sure they have what they need to be able to deliver our patients with the best possible service. We have an online platform which we communicate through. Day to day, we offer one-to-one support with the team leaders, coaching sessions. We like to ensure that we try and mirror the office environment as much as possible. We have a really nice rapport with our coordinators. In patient experience, we have a team of up to 90 coordinators, all working remotely. We communicate through group channels to make sure everyone's connected. I think just being able to support our coordinators, it's about making sure we're available when they need us. You know, we are constantly communicating with everyone throughout the day to make sure they have everything they need to be able to do their job successfully. Every week we hold a town hall meeting where the whole company comes together to discuss different areas of the business, to celebrate success, and especially the success and the support that our coordinators are offering our patients.
I've got plenty of friends that I've made sort of within only working here for 6 months, and feel like if there's anything I need or anything the patients need, that we can go above and beyond. And working from home, obviously, it gives you that better work-life balance as well. Personally, it gives me a lot more time with my family, which is obviously fantastic. And then you've still got the fact that it's not just a 9 till 5, you've got varied shifts where you can start earlier in the morning.
You're not tied to a desk every other weekend. So we do actually have flexibility. Like, I feel like I have a good work-life balance. I could work a shift on one day and then I still have time to go out and enjoy myself in the evening. Expect variety. That for me is a big draw.
As a coordinator at DCA, you get the opportunity to have appointments for you and 5 members of your family with a DCA doctor. You get private medical health care. You get the opportunity of earning an annual company bonus. You get 33 days holiday. In addition to that, you also get your birthday off. You get the opportunity of participating in some charity days of your choice to support the local community. There are opportunities within the patient experience for you to promote. Not only are there roles within the patient experience team where we've had people this year promoted into various different roles, there's also opportunities which we encourage for roles outside of the patient experience team. Several coordinators in the last 12 months have moved into different roles and learned new skills and stayed within the DCA family.
Lots of our coordinators have moved on and been promoted in the business. Currently, all the trainers in our team were coordinators, and I think that's really nice because when they are designing the materials for our induction, they very much have that in mind. For example, there's a great customer service apprenticeship route, and we offer this to all of our coordinators. It's just really good that they can learn alongside doing their role, and we support them with that. Or if they've got career aspirations, we can look into some of the courses that might support their career path, and we're always here to support them with that.
As a coordinator, you can progress up to a lead coordinator, and from there you can work your way up to be a team leader. Then of course there are all the other areas of DCA that you can become involved in, like the people team, recruitment, IT. We've had so many coordinators move on to different areas of the business, such as our clinical teams, training, quality assurance, IT, data management.
So within DCA, you do get the 33 days holiday, which is obviously fantastic. They've offered me something that I've not seen in other roles before, which is 4 days where they will allow you to go and volunteer for a charity or do some charity work that you feel really passionate about. So that all just lends to a real sort of culture of working well together, but also they're supporting you in your other sort of passions and endeavours as well.
In terms of the benefits, I mean, we do get healthcare insurance provided as well, which is a big relief again in a time where a lot of people are struggling to get access to healthcare. To be able to have that as a benefit is quite an attractive package. I like the flexibility we have because, again, with not being a standard 9 to 5, it allows for other people and allows for myself to be able to work around their work-life schedules. You know, people will have different schedules. Someone might have kids, maybe they can only work in the morning.
We have a very comprehensive training programme for our new starters, so it takes them right before they join, so we give them lots of updates as to what they can expect, and then on their first day they have a welcome meeting with the team and we go through the training plan. So in the 6-week period, the training starts with getting to know the business, getting to know DCA, getting to meet some of their colleagues. The training will provide them with access to all the systems and processes, our policies, so they know what needs to be done and why. And then it takes them right through to a training academy. They don't have to worry about being on the live system straight away. They can practice everything that they're being taught as they go along, embed the knowledge, have a play around. And then they also move into the final academy, which is hosted by the lead coordinators. And this is when they do get to use the live system, and they're fully supported with lead coordinators, with trainers, all through the journey. It's a very comprehensive training programme because we don't want to throw anybody in at the deep end. We really want them to get the knowledge, get the skills that they need before they do go live. So a new candidate, when they do come to DCA, can expect a really thorough, comprehensive training plan that's already been prepared for them. They all start on the same day, all our coordinators, which is really nice because they have that cohort and they go through the training plan together. We have a great onboarding team that will take you through that process to make sure on day one you've got everything you need to hit the ground running. On day one, you get to meet lots of key people, team leaders, different ones from across the business. And what's really nice is a lot of them used to be coordinators, lots of icebreakers, lots of introductions. So it's a really nice day, just to get to know the business and get to know each other. Our new starters can join us from anywhere and join the training. We do try and make sure it's engaging and there's a real mixture of activities. So there's lots of interaction, and we do include e-learning as well. And e-learning is great because for some of the more complex modules that our new starters need to know, they can take their own time, they can work through the e-learning. Training doesn't stop just after induction. We're always keeping our existing coordinators and colleagues up to date with any changes across the business, whether that is getting everybody into a virtual classroom to discuss the changes, or it might just be some e-learning with the updates in there. So we're really proud to support the apprenticeship programme at DCA, and we're always looking for ones that do tie in to the roles we have here.
I genuinely feel that our coordinators do make a difference to patients' lives. They're very supportive. All of our coordinators are really friendly and engaging, and they genuinely want to do the best for our patients. So I think the qualities that would make a really great coordinator are things like empathy, understanding, being able to listen, knowing when to offer support. And if you've got those qualities, you can't far go wrong in supporting someone.
Personally, for me, spending time with my family and friends is right up there. So having the later starts some weeks or the earlier starts other weeks, it really just aids a really nice, healthy working environment. I've never felt more supported in a role, actually, even though I work with nobody effectively. I'm sat on my own, but if you're stuck with anybody, we've got a variety of team leaders and even PX coordinators that can help you out via communications channels.
I think working remotely, the flexibility with our shift patterns is a real benefit. There's a 6-week shift pattern. You can start as early as 7 a.m, finish by 3:30, and the later shifts start at 12:30, finish at 9. You have a 1-hour lunch break, so there's a lot of flexibility about when you take your breaks. Being a coordinator, it's a very varied role, and as a team leader, it's very important that I provide the support our coordinators need to be able to deliver our patients with the best quality service they can. It's really important that our coordinators feel fulfilled in their role and that they are making a change to our patients' lives. We offer development plans to ensure that our coordinators are working towards their own ambitions. DCA is a great place to work if you are looking for development opportunities.